Thank you so much, Dr. Ibrahim. That was an excellent presentation. You provided us with information that are necessary to maintain or prevent pain management. Thank you so much.
My pleasure.
You do have some interesting background, though. You have a degree in
Chiropractic medicine.
In nursing. That's very
Nursing
very-
education.
Oh, okay. Can you explain about?
Well, I've been licensed as a chiropractor from the last 10 years. I've been a nurse since 2006, and I completed my master's degree of nursing sciences and education, specialized to be a nurse educator.
Oh. very good.
So I worked in multiple various settings, including nursing homes, management administrations, urgent care centers, pain managements. So, and a lot of times I would be facing issues and review cases, and I would disagree with the management and ask questions, and I get an answer for it,
Okay.
of course. So that's why I was very confident about what I was saying.
And
Giving
what
a
do you-
12 weeks period of time of conservative therapy is not my own time that I set. It's just a protocol.
Okay, that's actually is something that I want to ask you about, because I was a little bit confused when you were talking about 12 weeks window. So the question that I have is, if I have pain, do I have to wait for 12 weeks before I seek help, or call my doctor's attention to the pain?
Okay. Upon experiencing a lower back pain or a neck pain, of course you need to get contact with your primary care physician. Okay?
Right away, or do
Right away,
Okay.
within 24 hours, unless, as I mentioned in my presentations, that there is a sharp, severe abdominal accompanied with lower back pain, severe in intensity, without any apparent cause, never happened before in the past.
So this is a pain that is
It is just as much important as calling for a chest pain on a heart attack. We'll call 911.
call
911 will transfer you into the emergency room to rule out the aortic aneurysm, which I mean by a pipe. Actually, this is the heart. Every time the heart pumps, when it pumps the blood from the heart through a pipe. It's called the aorta. It comes from the left side, and it goes around like that, like a knob. It gives branches like a tree, okay, for the blood supply for our hands, our organs, and our legs. Sometimes that pipe is capable of getting hardened because of atherosclerosis or other issues that make it thinner and about to get blown up like a balloon. That would need an emergency attention that could lead into an emergency major abdominal or vascular surgery.
So in other words, you have sharp, sudden pain, seek help right away. Call 911.
Sharp, sudden pain without any apparent cause never happened to you. Let's say you're getting into your work, you have that, call 911 right away.
Right away.
Right away.
Thank you so much. That made it more clearer.
And the same thing happened for the neck. If you feel any dizziness, blurry vision, or something like that, and a fever accompanied with a stiff neck, you wake up like that, you call up 911, not a primary care physician. Now, if you're experiencing a dull, achy pain that has been going on for a couple days, on and off, you need to call your primary care physician, take an appointment, hopefully soon, within hours or a day or so, to investigate the cause of the lower back or the neck. It could be, if it's in the lower back, it could be a lower urinary tract infection. Your primary care physician will screen for that through urine analysis at least, if it's not a blood test, and give you a medication hopefully, and it will get removed. It could be a kidney stone. It could be a prostate issue if it's a male. It could be uterus problem with the females. It could be many issues. If it is ruled out to be only a musculoskeletal, which is bone, ligament, and muscle, then you have a 12 weeks window period of time to take care of it via getting referred into a physical therapist and or chiropractic, whatever you prefer, and exercise and reinforce my exercises that I showed you, and using the right ergonomics to improve on your lower back pain.
Very good. Thank you so much. So in other words, do not neglect.
No, do not neglect any pain.
Ignore your pain.
Yeah, do not ignore it.
Okay.
Now, if it comes up, and here, the goal of my presentation is, what are your choices in life? If this is determined to be a musculoskeletal, and the doctor tells you, you know, you need to go for MRI, just to rule out if there is any problem with the disc because x-rays will not show it, right over there, you can think about it, just say, doctor, is nothing else but you think is a disc or a bone and it's a musculoskeletal? If the answer yes, then you would say, you know what, can I hold on to this invasive procedure, magnetic resonance imaging, okay, for a couple weeks, get a home care exercises, heating pad, and getting some anti-inflammatory, if it's possible, deemed to be appropriate by the physician. Some physicians will give you an opioid low dosage along with anti-inflammatory, and address any other issues. If it's an obesity or other stuff, you will have like a weight loss, you would consider it, or you might want to consider getting referred into a registered dietitianist who can suggest for you, recommend for you a menu of food enriched with supplements that is enriched with anti-inflammatory. You know, a lot of supplements out there that is enriched with anti-inflammatory and will cause your pain to decrease and decrease and decrease. If you get into the point after 12 weeks that the pain is getting worse and worse and worse and increase in intensity, your last resort would be an epidural and a combination of radiofrequency ablation as I discussed. And I hope that you would ask me questions about it so I can rectify the issue more.
Okay, now talking about the epidural injection in combination with other procedure, such as the radiofrequency inflammation, can you shed more light on that?
Well, here is what is going on. Radiofrequency ablation is not something new. It's an old. Okay, it's used usually on cardiac patients, individuals who are born with something is called a circuit. They will individuals who experience a very fast heartbeat, and it is proved through electrophysiology, through cardiologists, that there is a circuit that goes around and causes the heart to beat fast for no apparent reason. Just they were born with an extra fibers, okay? So they will go, a cardiothoracic surgeon, okay, or a cardiologist, apply a procedure or wire and get it through that fibers and paralyze it.
Okay.
The same thing, I was reading 2 books in 2002 that American Medical Association from Physical Medicine Rehab and internal medicine had 2 cases on the neck and the lower back that somebody had been subjected into a trauma, but there was negative findings on MRI, no disc herniations, nothing happened. Conservative therapy failed to achieve any improvement on pain intensity. Patient was experiencing loss of headache and lower back, okay? No medication would help. What was the reason? The investigation came out that the articulation of the vertebra is encapsulated with satellites. And those satellites are connected with fibers. Those are pain fibers that will go to the head and go down and give a muscle spasm and give a headache. So actually, in a nutshell, chiropractic and American Medical Association, at least, I hope I'm not sarcastic, would agree that the zycopophyseal joint, the articulation is called zycopophyseal joint. You don't have to know that, the name, but the articulation it's really have a satellite. Okay? And those satellites could be paralyzed through radiofrequency ablation. And not paralyzed means paralyze the whole nerve. Just paralyze this, nest around it, because there will be a friction or some type of pathology of that articulation. They just lose maybe the cartilage, or they are asymmetrical or abnormal movement. That's how chiropractic came into a development, and they say manipulation will remove any lower back pain. So what I am saying that in addition to an epidural, having epidural injection 3 times or 4 times in 1 month initially, why we don't have a combination? We don't attack the problem from outside of the envelope of the spinal cord, which is called the meninges, and paralyzing those satellites will give us an optimal effect, instead of having like injecting and boosting the outside, the envelope of the spinal cord, the meninges, injecting it with needles. Maybe that would cause the meningitis. I'm not here to point any fingers. What caused this epidemic disease, meningitis? Is it the pharmaceuticals, corticosteroids? Actually, personally, I don't think so, because it's been going on in the market for decades.
Yeah, we'll
and
talk
it's
about
treating
that.
asthma.
Yeah, we'll talk about that in another presentation.
Another presentation. But what I would think is epidural in combination with other modalities that are offered in pain management offices as well should be implemented to attack all the pain and finish up with it. Instead of having a 6 month after a couple shots in 1 month, and then every 6 months you will have an injection, people get used into sedentary lifestyle. They don't have to do any functional movement. They don't have to do any conservative therapy. They don't have to do anything. People would just get it for granted. I'm not saying that I'm not recommending. Physician recommend you up on epidural will give you a boost to be pain-free, but you have to continue with your regimen of exercises for you not to have this episode to come again.
Thank you so much,
You're
Dr.
welcome.
Ibrahim. You've really provided us with a comprehensive analysis of pain management, what to look out for, the symptoms and stuff like that. Thank you so much.
I hope it's been very helpful to you too.
Yes. This is just to let you know that this is not a substitute for medical advice. This is just for informational purpose only, and we look forward to seeing you at another time. Thank you so much.
Thanks
and have
for
a nice day.
Thank you.